Okay, we're busy.
All right. So once again, my name is Tariq, Dr. Phillips. I'm one of the resident physicians, specifically with, we call it the hepatobiliary surgery service, okay? We're a special type of abdominal surgery service that deals with problems, whether that's with the liver or the pancreas or kind of intestines, which there could be a question about that, okay?
Sure.
I'm not stating that you need surgery right now or anything else, okay?
Oncology has to decide that.
That could be something that we have to decide, okay?
I saw an oncologist before,
Okay.
5 years ago,
For
for potential markers in my blood that were abnormal.
do you know the name of the markers?
No, but it'll be on my chart. And the doctor's name was Dr. Phillips.
Oh, I don't remember seeing you 5 years ago, but you know it's a common name.
It was a woman, no less, so it's definitely not you.
Definitely not me.
And then she retired, and I went on to see Dr. Sarah Sedan,
Okay.
also Montefiore.
Gotcha.
I think she's Scarsdale Medical Group.
Gotcha.
I do Scarsdale Medical Group and White Plains
Gotcha.
Hospital.
Okay, I'm not sure if they share right here to Montefiore, but
They
we'll
do.
take a look. They do? Okay.
Yeah.
I'll take a look, okay? And you said 5 years ago. So
Yeah, something like that.
yeah. And at least I saw, at least someone noted that you kind of had a pretty extensive workup with that too, where they were checking you for a lot of other blood levels of things that could be secreted and things like that.
Yeah, I was begging them to check everything, and they did.
And well, what I saw noted was
Everything
they
negative.
mostly negative and normal.
Yeah, everything was negative.
That when was that? Do you know when they did all that? That's 5 years ago?
Over the last year.
Over the last year. Okay.
Yeah.
Okay. Gotcha.
You know,
Okay.
I started having symptoms in May 15th, 2023. I mean, I remember the day it
all of a
started.
sudden and just kept going diarrhea.
And it's never subsided.
Lots of belly pain with it or just diarrhea?
No belly pain.
Just diarrhea.
No pain.
Gotcha. And usually smells
Discomfort.
usually smells pretty bad.
Severe.
Okay. Oily.
Oily.
Sometimes
bloats.
dark. Bloats.
I had black stools on Thursday and Friday.
Gotcha.
I had some blueberries on Monday and yesterday in my protein shake, which I brought protein shake, homemade,
Good.
and it did have blueberries in it, I think.
And,
So when it turned black yesterday, it could be that.
and all in all, you lost 60 pounds.
More like 45.
40 pounds.
I did
45.
you know, it's over the last two and a half years that I lost 45 pounds,
Gotcha.
or even 50.
And
I was as high as 205, now I'm 145. So
they
it doesn't
tried
matter.
you on a few different medicines, but eventually they gave you something a little bit more for the pancreas and might have helped a little
The
bit.
Creon.
Yeah, but it didn't stop the diarrhea, but might have helped some of the weight loss or anything.
Exactly. It stopped the weight loss. Now I go back and forth between 145 and 155.
You don't get pain with eating or anything like that?
No, just feeling like I have to go immediately after I eat.
Got immediately. Colonoscopy last year that was normal.
Negative.
Yeah. Gotcha. No history of any cancers or concerns in the family like that?
My mother had lung cancer. She smoked. Yeah, 20, 30 years ago she smoked. So my sister had ovarian cancer. So neither one is going to be
Gotcha.
applicable
And
to the
as
situation.
far as like breathing problems or difficulties you're having right now?
Not now, but I had COVID 2 years ago, July 2022.
Gotcha.
And I had long COVID after that. And then subsequently to that,
Gotcha.
over the last year and a half, I've had one repeated infection in my lungs after another.
Gotcha.
And I definitely had wheezing, and I've had asthma since I was a kid, but it comes and goes, you know, and I think it's more flowers related than anything else.
Allergies and asthma. Okay. Allergies and asthma can definitely kind of be linked together.
No, I went to an allergist and
Oh,
he didn't
okay.
find anything.
Okay. Let me see here.
My primary thought I might be a candidate for cystic fibrosis, so I went and had the gene testing at Westchester County Medical Center, and so that's not in the Montefiore system, so you won't see it, and they're lost with their portal. They had no idea how to
Yeah.
transmit it to.
Gotcha. But
My
that was still
chart.
negative too.
That was negative.
Okay.
And they do 180 markers
Gotcha.
as opposed to like 30 or 40, which is the norm. So
And no
I
one,
feel confident that it wasn't
yeah,
cystic
no one in your
fibrosis.
family with cystic fibrosis.
No.
or anything before either. Okay. Let me see. What else can I think about? What else can we state? Okay.
Okay, so there's a mass.
Right. So. Yeah,
He
you're
said on the
gonna-
head of the pancreas.
So there is concerns or consistency with changes in your pancreas that line up with likely a mass. Okay.
Okay.
So the pancreas, you know what the pancreas is, does,
Yeah.
and everything else, right? It has a whole bunch of different abilities. Helps with your blood sugar, sends out.
So I'm
hormones,
diabetic.
right.
Been
Your-
diabetic
your
since
diabetes
2000.
is pretty well controlled.
Yep.
What do
I
you-
went as high as 7.5.
What do you use for it?
Right now I'm on
Metformin and stuff?
Farxiga
Farxiga.
and
But no insulin.
glipizide, no insulin.
No, you don't.
The only time I've had insulin is when I've been in the hospital for surgery.
Okay, that's pretty good. That's pretty good. And you had the surgery. You said you had the, well, you can say, but you had the appendicitis, the appendectomy, and you had the
Inguinal hernia.
Inguinal hernia on
The
the
right
side.
one.
Yeah.
My left, I mean, you could see it through
Yeah,
there.
the
It's
little left one as well.
it's looks like a freaking tennis
So,
ball.
does it hurt you?
It was very uncomfortable for a long time,
Right.
and now it feels like there's air pushing it out. Can I
Okay.
show you?
Gotcha. Yeah, we're gonna look through everything.
Okay, good. And and then I have an umbilical hernia that's
see that.
getting larger and larger and larger.
Okay. But so you feel like air, maybe some discomfort, but it doesn't necessarily hurt you. You poop too much, kind of.
Right. I mean, I want to get the hernias
Yeah.
taken care of, and they're refusing because I won't heal fast enough.
So I mean, that's something to think about. Gotta take care of this or think about this first.
Okay.
But there's definitely also not, usually from what I'm hearing, there's not necessarily a rush. If, one, I think one of your prior CTs looked like it was just fat in there. Maybe there was occasionally some air or fat, but that's not too bad and there's no bowel.
Right.
And then, two, it's not causing you too much pain or symptomatology, like you're pooping normally
Right.
as far as like,
It's more unsightly
Yeah.
and just
so.
uncomfortable, but no pain.
Yeah.
I haven't had any pain until Thursday night. I started to have bloating and discomfort, and I saw Dr. Bellamere, who's part of it.
Yeah, that's what,
You know Dr. Bellamere.
that's one of my bosses. Yeah.
I see. And so she examined me. I told her I was going to see Dr. Fortune. Should I see him? She said yes.
So she saw you on Thursday.
No, she saw me like 2 or 3 weeks ago.
Oh, okay.
2 weeks ago.
I missed that one up. Okay.
And she said, oh yeah, Dr. Fortune's wonderful. Go to him. I think he might be more suited to your needs than me.
Mhm.
And I'll follow up with you, and please let me know what's going on. She was pretty
Dr.
pretty
Fortune's-
great.
Sorry, I don't work with Dr. Fortune's which one? What kind of doctor is he? Do you know?
He's GI as
GI.
well, liver transplant.
Okay.
Yeah,
Gotcha.
which I don't want.
Yeah. Okay.
Is there any tumors on my liver?
So what we can see currently looks like or like I said, your pancreas does many things, help with digestion, blood sugars, and those types of things. And it has a highway, a duct, a tube, right?
Mhm.
There, it kind of drains into the intestine, right?
Right.
And near the area where it starts inserting in the intestine, that tube looks like it's collapsing abnormally, okay? Like there's something that suddenly presses on it and collapses on it.
So then the pancreatic enzymes aren't getting through.
Potentially, but I mean, at least one of your previous studies looked like it wasn't too bad, so I'm trying to figure out exactly.
How about fatty liver?
Yeah.
Do I have fatty liver?
Your liver didn't look too bad from what I saw. Your liver numbers seemed pretty okay for now, so I
Okay.
can't really say much about that.
How the elastase
The
was
elastase
under
was
15,
under
and that's
15 last
a
time.
great concern, isn't it?
Yeah. No, usually I think it would be over.
No, over 100
Yeah.
is
so
good.
Let me. But I'll make sure because I want to make sure exactly what you got last time, so I don't give you the wrong.
Okay. Oh, and by the way, my A1C last time around was 6.6.
Yeah, 6. I think they just rechecked you and it was like up.
Or did they just do it?
Yeah, it was
Did they do testosterone?
Not that I saw.
So,
I saw. I think
10 years ago-
6'7" and 6'8", or 6'6" and then 6'7", so it was about the same.
gotcha. 10 years ago, I had very, very low testosterone. 12 years ago. And so they put me on testosterone injections, and I wasn't consistent with them at all, and I had severe night sweats, and I was hot all the time. I mean, like burning hot. And
No new lumps or bumps to the testicles or anything else like that.
no.
Okay.
So with the testosterone level, I stopped the testosterone injections completely, and then I went on Clomid.
Okay.
So I've been on Clomid now for like 2 years, and I actually just went to see the urologist, and he said that I have a clean bill of health, and my prostate number was like 0.40 instead of
Good.
over 1. I mean, it was under 1.
Good. No, it's very small. Okay. Anything else? So we talked about surgeries to the belly that you had. We said the hernia. We said the appendix. You had atrial fibrillation, in which case you had an ablation.
Right. So
Twice.
I've always had heart issues,
Uh-huh.
and for years I was on propranolol, and then
And you got off of it after the ablation.
my cardiologist put me on Toprol instead. This was in Florida, and I took Toprol for the period between then, which was 2007 or 2008. I don't know, more like 2010. And then I became very short on breath and very winded, and so on and so forth. And I had the first open heart surgery. I had bleeding in my mouth. I had pneumonia. And then they did the mitral valve repair and an ablation at the same time in
Gotcha.
in 2012.
Do they put you, or are you still on blood thinners?
Only just the
aspirin?
metoprolol,
Just the
which
metoprolol?
isn't the blood thinner,
So-
and 1 aspirin a day.
Yeah, aspirin.
And then-
nothing like Eliquis, warfarin,
No.
Lovenox.
I was on warfarin for
Dabigatran,
5 years.
Rivaroxaban, all those things don't. Or you're on 5 years and then stop.
5 years. Then I had a second ablation in 2015,
Gotcha.
and they took me off of the warfarin around that time.
I hear you.
The ablation was successful. The atrial fibrillation stopped,
Okay.
and I got healthier right before the second ablation. I was very sick,
Okay.
so
Okay.
and so that's my heart stuff.
But now you're off metoprolol, or still?
I take 0.50 or 50 milligrams,
Okay.
and I was on 100 until a few months ago. My cardiologist, now a different one, wanted me to drop it in half because I had low blood pressure,
Good. Okay.
and my numbers keep on coming in. The systolic comes in, diastolic.
Exactly.
The diastolic number is, sometimes it's 70. It was 55 last
Okay.
night.
Okay. 55 can be okay. It depends. I would more care about the average too sometimes because.
Right, and I couldn't tolerate metformin.
Yeah.
I hated that.
Metformin.
I had tremendous runs with metformin, and then I stopped taking it on doctor's advice, and
Gotcha.
I did the Farxiga instead. I did some Trulicity.
Okay.
I did Trulicity for the period right before the right before the symptoms began.
Gotcha. And no yellowing to the skin, yellowing
No.
to the eyes that you notice. No,
No.
itching. No.
Itching?
No. Yeah.
No,
No. Confusion, feeling like you're changes in memory or anything else like that.
no. I'm always
It's a silly question.
Yeah.
All right.
my father had Alzheimer's, so.
Yeah.
Yeah.
And sometimes, if blood levels get a little strange with some of these masses, can happen, and these can cause little bits of confusion. That's temporary. But all right.
Gotta wait till the biopsies come back.
Yeah.
Do they keep me in the hospital between now and
You
then?
didn't get the endoscopy yet. They're planning.
I had it this
You
morning.
got it? I guess I didn't, or they didn't write their note from this morning. Because I know I saw that they were planning. Okay, so they did the one.
What did you see? The CAT scan?
I saw the CAT scan.
Okay.
I saw the CAT scan, and then they told me about you. Read a little bit about you. And I was like, okay, let me get over here.
Okay, I appreciate that very much.
No worries. They'll write that note about the endoscopy, and then we gotta wait for the biopsies, and we'll see from there. Okay.
Okay,
But
do they
most
keep me
likely-
here? Or?
Most likely, I
Yeah.
think we might even get a closer belly scan because the CT that we get, the CT is not always the most precise. So
Okay.
we might do a.
Why not?
So the CT is kind of it doesn't, the way it works, the CT, right? It sends radiation at you, and it kind of bounces off certain densities of tissue.
Okay.
Right? Can be really great for seeing certain densities, but it doesn't have the resolution to see very clearly slight changes in tissue. It kind of averages them all
Right.
decently well together, right? So there's some things we can see, some things we can't. The MRI, right? The way that works is it
You can hear my stomach.
Huh?
You can hear my stomach.
It's going. It looks at the content of water in different tissues, and that it does very precisely, and you're able to see much better resolution or differences in between tissue. Okay. So I can get a very closer scan of exactly the area I want to see, which is like, you know, from here down. Okay.
Yeah.
So I can see the liver, I can see the portion of the intestine, I can see the pancreas. That I think will be very important, possibly. Okay. So I want to talk with my boss or Dr. Bellamar about that too. Okay. Let's see. Anything else? All right. Is it okay if I examine your belly?
Oh, yeah.
I'll examine your belly. I'll examine your
Want me to
belly.
drop this?
Yeah, you can just drop and you can lift.
Oh, I really wanted you to see this hernia.
Oh, yeah, it's big.
It's big.
Does it go back in pretty well?
No,
No?
I mean, it was, but it's not now.
It's not bad. So I know you're walking around. It feels like it reduces or it's reducing. It probably doesn't stay out. I mean, it probably doesn't
Doesn't
stay
stay in at all. Soon as I cough or bear down, it goes right back to where it was.
Yeah, maybe a little bit of
Fluid.
intestine in there, maybe fluid, potentially. But I would say that this is what we call reducible or pushable back in,
Mhm.
right? Not too tight. It doesn't cause you pain, which is another good sign, right? But because potentially the hole is pretty big and you got some pressure likely in your belly, come the way you're sitting or whatever else, it'll probably just kind of slowly.
And they fix that when they
Hmm?
do.
I don't know. So this would be something.
Sorry for not closing the curtain.
This would be sorry.
Mr. Malivelli.
This would be something that they would fix when
Hello.
when ready, as far as like making sure that you're most healthy for the thing that I think is more concerning right now, and something that we have to work up right now. But give me a deep breath. Yeah, exhale. Inhale. Exhale. There you go. One
Hi.
more.
I'm doing it backwards.
Yeah, I know. It's fine. Exactly what you're doing. It's fine. One more. Okay. All right. Okay.
Now, this is enlarged in the last few days
Yeah, I think there was a little bit of fluid in your CT too.
in the liver and the pancreas. Or
Yeah. So there's a little fluid as far as throughout your
they
belly.
said they were going to extract it yesterday.
Oh, draw out the fluid?
Yeah, and
Potentially.
yeah, the Dr.
Mr.
Carducci or whatever his name was said he was going to come back to do a digital exam.
Okay.
It wasn't done.
So I'm probably gonna talk to Dr. Bellamar, you know, because at least she's seen you. I'll look at what she said last time specifically because I missed that one.
Okay.
Um,
My chart has some holes in it. It doesn't allow you to search very well.
everything.
I don't know if the doctor's end of it is better, but
It'll
the
vary.
patient's isn't.
It'll vary. Usually I'm able to find what I need, but sometimes, you know, you have a long history and it all kind of is too much sometimes. But I'll take a look at least to see, especially what Dr. Bellamar saw, again, my boss here. And then we'll talk about the CT. I think we'll need some more imaging. We'll see if there's potential need for repeating a lot of the labs that you already had. But I think you already, like, oh, these 2 minutes can cause a whole bunch of diarrhea. But I think my main concern is probably getting further imaging and then following up the biopsy first.
Do you know what my A1C number was?
Yeah, so that was I think you were 6.6
When?
last time, like maybe
Yeah.
2 months ago or so. And then
Yeah.
6.7 today, or like 2 days ago.
Okay.
Or it might have been 1 point more, maybe 6.7 2 months ago, and 6.8, I think is probably.
Can you draw for testosterone to satisfy the endocrinologist's need?
So
I know that I see the urologist for testosterone, but she put it down on the blood work that was supposed to get on Monday.
Mhm.
I was getting pre-drawn, and then I'm gonna have a video appointment with her on the 15th.
Mhm.
The TSH was elevated, but the T4 was in the normal range.
Let me see. Although again, also some of your numbers are a little elevated, that can be concerning for really hyperactive tissues.
Okay, I also had abnormal hemoglobin. Is hemoglobin?
Yep, like I said, 6.7 5 months ago, 6.8.
That's the A1C.
Yeah. Just what I was showing it to you.
The last number, the first number is the most recent?
Yeah, the one on the left is the most recent. Here.
Okay.
Yep, that's from this AM, 6.8.
All right. Oh, I meant to say white blood cells. My
Oh.
white blood cells
No,
were,
your white blood cells were normal.
there was a time
It was-
period, it was 1100.
Yeah,
It was
to 11,000. It's a little
11,000, I'm
high.
sorry.
Yeah, no, it's fine. 11,000 could be a little high, but yours now I think we're around 5 or 6.
Oh,
Yeah.
okay.
5. Alright, that's okay. That's fine. Hemoglobin a little low, that's perfectly okay.
Okay.
11 of hemoglobin is nothing necessarily. There's many people who walk around 10, 8. Sometimes, again, if you have something else going on, your body
Mm-hmm.
slows down on the focus of making sure your hemoglobin is super high, or it might be a little lower than.
My primary saw
But that's fine.
that there were, he wanted to rule out immunoglobulin deficiency and potentially to supplement. I went to see an allergist, Dr. Sperber, and he tested me for everything,
That's still nothing.
nothing.
Yeah. Let me talk with, because I know at least now on imaging, sadly, but also we have an idea because we see this and we have to work it up further,
Right.
which I think is going to require an MRI and following up the beat. Oh, let me see if, and the,
What time is it?
let me, 5:30. Let me
Oh,
see
okay.
if the,
Too late to get in touch with Dr. Girardi, my cardiologist, to see if he wants to lower my metoprolol, and also here's what happened. I attempted to get him the record of what the circle in my valve is. It's metal, but I don't know what kind of metal.
Oh,
And so they sent all the records from my open heart surgery from Broward General in Fort Lauderdale. However, there was no mention of it. And I called the cardiothoracic surgeon. His name was
Rule 57, he's
well,
assistant.
that's okay. I mean, that is definitely interesting. I think we should, or if you can, call that surgeon to make sure.
I called him, and he was very abrupt and said, "Don't bother me." That basically, and call Broward General for your records.
Yeah.
I'm a busy man. That was his attitude.
I'm sorry
But
about
he was a great guy.
when he's helping you.
Yeah.
But when he's not helping you, he's
Well,
not.
I'm sure he's busy.
Yeah, it might be. But yeah, I would call possibly Broward General or whichever else to, and they maybe your primary team might be able to as well, just to make sure that if you do have a valve, that it's safe for the bigger scan,
Okay.
the magnetic scan, the MRI. Okay,
So that one's better than the CAT scan?
it's better than the CAT scan for what we're thinking of right now.
Okay.
But we have to make sure that you have no other metals in your body other than you're saying this valve potentially.
I have titanium in my jaws
Okay.
and
So-
my chin.
So they'll just.
In the chin?
Yeah,
I mean,
because-
if you feel here,
Uh-huh.
you can feel wires.
Yeah, I think they'll just have to check as well yet again to make sure that it's alive.
That doctor's readily available.
Okay.
But I'm certain that it was titanium,
Yeah, which is usually fine.
but not the open heart.
Yeah. Yeah.
Now I see two of you. I have double vision without the glasses.
Okay. No.
Did you feel this
I did
here?
a little bit, just so you can pretty light.
You were,
Okay.
yeah.
Okay. Yeah, right there.
And then it's on that side,
Yeah.
and it's on the inside as well.
Okay.
And
There. Okay. I see.
so
All right. So.
I had degenerative arthritic jaw syndrome.
Gotcha.
That's what
Just
that
broke
was.
down. So let me talk with Dr. Bellamar. We'll see if we can clear you to be safe. You gotta tell more to your primary team all the metals and see if they can figure out to make sure that it's safe
Okay,
For,
I'll push for that too.
for that. But I think that's most likely gonna be the next step. But I'll see if she wants that too. But
Okay,
that's probably what we're gonna see from there, then we get a better idea, and we follow up the biopsy that they got. Okay.
That takes about a week.
It can, but sometimes I can make a few calls and get in like 3 or 4 days, maybe, if we can figure out what Dr. Bellamar also needs. Okay.
Okay, sir.
All right.
Thanks for your time.
No worries.
All right.
Your pleasure to talk, sir.
Take care. 302? I just ate a lot, but
Ah.
that's extreme. But even still, that's very, very high, isn't it?
Yeah.
My endocrinologist,
What did you eat? A lot of food?
I ate a lot.
You know everything?
And then my stuff too.
I know. You know?
I have a massive appetite.
I know. I
I
realize.
got the opposite problem that Rick has. Do you think I need an insulin shot?
No, I don't think so.
No? Okay. Should I do exercise?
I guess, but let me see what the doctor want to do, okay?
Okay.
I'll tell them. I'll let them know.
I'm never that high. I usually don't go above 200.
Okay.
Enough stress could do it too.
Oh, yeah, definitely. That too.
Yay! Pardon me. Burping up a storm. Oops.